Good evening, and thank you for joining the Charmettes Incorporated, Moffitt Cancer Center, and the Leukemia and Lymphoma Society as we present Candid Conversations with Dr. Brandon Blue. The Charmettes Incorporated is a sisterhood of dedicated women committed to improving the quality of life within our community through advocacy, education, service, and support for cancer research. We are excited that you chose to register via Zoom as we go Facebook Live for tonight's educational event titled Multiple Myeloma and the Effect on People of Color. We will now have an official welcome from the National President of the Charmettes Incorporated, Cicely Robinson Duffy, and Vice President of the Hillsborough County Chapter, Jacqueline Wiles. VP Wiles, if you will unmute yourself, please. We may have to come back to our VP Jacqueline Wiles of the Hillsborough County Chapter of the Charmettes Incorporated. It almost looks as though there is some technical difficulties going on there. So we are going to move forward with an introduction of our next presenter, which is Mia Johnson Turner. She is the National Community Outreach Manager for Myeloma Link for the Leukemia and Lymphoma Society.
Evelyn.
Mia is an entrepreneurial, speaker, published author, consultant, therapist, and ordained minister with a personal mission of empowering others to live on the purpose by making the most of every opportunity for social and economic development. Mia holds a BS in psychology, counseling concentration, and a master's in professional counseling. Mia is currently pursuing her doctorate in Christian psychology and is a licensed clinical member and certified pastoral counselor, NCCA, and is a certified licensed temperament therapist. Miss Mia Johnson, welcome.
Thank you so much, Dr. Nelson Winters. It is an honor to be here tonight, and thank you for the invitation and the opportunity to partner. My name is Mia Johnson Turner. I'm a National Community Outreach Manager at the Leukemia and Lymphoma Society, also known as LLS. We are one of the world's largest voluntary nonprofit dedicated to funding blood cancer research, support, and advocacy. Our mission is to cure leukemia, lymphoma, Hodgkin's disease, and myeloma, and improve the quality of life of patients and their families. This mission is carried out through research, patient and professional education and services, and advocating for cures and access to care. LLS support services include up-to-date disease and treatment information provided through the LLS website and printed booklets, as well as through our one-on-one dialogue with information specialists in LLS's Information Resource Center, better known as the IRC. The IRC is on the front lines of LLS's efforts to improve patient access to quality care and to improve patient quality of life. The information specialists, nurses, social workers, and public health professionals are highly trained in blood cancers and latest treatment options, and they are skilled at connecting patients and caregivers to the psychosocial support, financial assistance, insurance, and legal guidance that LLS and other organizations around the country can provide. If you or a loved one would like to contact our Information Resource Center and speak to one of our information specialists, you may visit lls.org or call 1-800-955-4572. LLS provides free support, resources, and referrals, as well as virtual and local in-person education programs and videos to help all patients, survivors, and their families stay informed about and access the best possible treatment and follow-up care. LLS patient services, some of which you can see and hear about tonight, include co-pay assistance, transportation and urgent need assistance, one-on-one peer-to-peer support, nutrition counseling, online chats and forums, and support groups. Now, despite incredible treatment advances, however, all blood cancer patients do not have equal access to these treatments. And so Black Americans have more than twice the incidence of myeloma than any other racial group. And research also indicates that lower income Blacks in particular are most vulnerable to receiving suboptimal care and to potentially experiencing poorer quality of life and outcomes. And so in response to these disparities in incidence and access to care, LLS launched a national outreach program in 2017 called Myeloma Link to educate Black communities about myeloma and to help patients in these communities navigate the treatment landscape more effectively and cope with the disease. The program started as a pilot in Atlanta, Georgia, and Washington, D.C. back in March 2017, and guided by extensive evaluation data and feedback from staff, volunteers, and patients, the program has since expanded to 14 additional cities to include a total of 16 locations. And since its inception in 2017, the program has reached over 100,000 individuals through more than 450 programs in Black communities through the country. Myeloma Link has achieved its goals through activities carried out by LLS patients and community outreach field staff and trained volunteers. These include patient education programs, church outreach through various activities, including health-related topics during services in Black churches, community education programs in collaboration with trusted partner organizations, and of course, myeloma education programs for community-based primary care providers. Again, if you are interested in knowing more about LLS and Myeloma Link, and just finding out a little bit more about some of the services that we provide, please don't hesitate to visit us on our website at www.lls.org, or you can simply call 1-800-955-4572. Again, that's 1-800-955-4572. Thank you so much for your time.
And thank you, Mia Johnson, for that information. If you'd be so kind to put those phone numbers and links in the chat, that would be greatly appreciated. Now, before I introduce the speaker of the hour, I want to make sure that our Hillsborough County chapter Vice President of the Charmettes Incorporated was able to get on to say good evening before we start the event.
Yes, Madam Chairperson. This is Jacqueline Wiles, and technical difficulties from some of our people trying to get on. But I just wanted to extend a hearty welcome to our guests today, especially Mia Johnson and Dr. Blue, who are our presenters, and all those who have joined in with us because you are too concerned about and interested in myeloma as it pertains to people of color. But I won't extend the time just talking. I just want to get you familiar with what these young people have, and I'm saying young people have to offer to us this evening, and that's going to make our lives a whole lot better. Thank you very much.
Thank you, VP Wiles. And now a brief introduction for the speaker of the hour, Dr. Brandon Blue. Dr. Brandon Blue is an assistant member and clinical instructor in the Department of Malignant Hematology at Moffitt Cancer Center. He earned his MD from Meharry Medical Residency in Nashville, Tennessee. He completed an internal medicine residency in the Department of Medicine and a hematology oncology fellowship at St. Louis University School of Medicine in St. Louis, Missouri. Dr. Blue completed a blood and marrow transplant and cellular immunotherapy fellowship at Moffitt Cancer Center. Dr. Blue's clinical interests include treatment of plasma cell disorders and evaluation of patients pre- and post-stem and bone marrow transplant. His research interests include reducing health disparities and improving health outcomes for plasma cell dyscrasias. It is the pleasure of the Charmettes Incorporated to introduce to you Dr. Brandon Blue.
Hello, everybody. Thank you. Thank you so much for that wonderful invitation to talk today and that wonderful introduction. I appreciate this time. And hopefully, like I said, we all learned something today. But really, my goal today is to just share with you a little bit of information about something that I do every day to try to see if we can help not only the people on this call, but our friends and family as well. So I will share my screen and I will get started. So today we will be discussing really multiple myeloma and really how does it affect people of color, okay? And that's really what I wanted to kind of make sure that we drill down some of this information today. You know, and I'm sure you know this because you guys are the ones who are here listening to me, but you know, awareness is always the beginning of some type of positive change. And really for our people, for people of color, we really need some kind of change to take place because unfortunately, you know, if there's a race, we running in last place a lot of times. So I just wanted to just let people know that, like, you know, when you think about any type of disease or illness, it's not always going to be the same for everybody, right? So if you think about like heart disease or diabetes, high blood pressure, anything, there's going to be something that really can make that different depending on who you're talking to. For example, it could be race, right? It could be Black people, white people, Hispanic, you know, it could be sex, it could be men versus women, it could be age, older people, younger people. It could be something about that person that makes that disease different than the very next person, even with the same disease, okay? And just know that that's where a lot of research and that's where a lot of people trying to figure out is that, you know, how you got two people with the same problem, but because this person Black and this person white, there's a difference. You know, we don't know that. We don't know if it's something that's from a biology standpoint, meaning that is it something like in the DNA of Black folks that's causing this to happen? Or is it just the environment? You know, they used to say the old question of, is it nature versus nurture? And that's one of the things that we're trying to figure out. But just know that happens in a lot of different problems, and that's true for cancer as well. So let's talk about cancer, right? So, you know, our whole body is made up of cells, right? Your body, my body, everybody's body is made of cells. The problem comes in is that your body should be able to control how much and fast those cells grow, okay? But if the body cannot control it and these things continue to grow and the body was like, hey, I didn't tell you to do that, and they keep growing, then that's unfortunately where it becomes cancerous. Because if the body can't control it, that means that thing just gonna keep growing despite what the body tell it to do or not. Sometimes people get growths of these extra cells in their breast and they end up with breast cancer. Sometimes they get growths of these things in their colon and they end up with colon cancer. But today we're going to talk about a specific type of cancer that's a growth in the bone marrow where people end up developing a blood and bone marrow cancer. Okay, so just know that, you know, it's really something that just goes wrong with these cells and just allows them to happen. The type of cell that we're talking about today is something called a plasma cell. You say, what the heck is that? But that's the cancer that goes wrong in multiple myeloma. So we all have blood cells, right? We have white blood cells, red blood cells. We have something called platelets. The big thing to know is that these white blood cells are part of your immune system. That's what protects you from COVID. That's what protects you from the flu, okay? And a part of these white blood cells, you get plasma cells. So when people get a cancer of plasma cells, just know we all have plasma cells, but it's when, unfortunately, they start growing and they shouldn't grow is when the problem comes in. And where that problem happens is inside of this bone marrow. So if you look at this picture here, inside of the bones is the bone marrow. So, you know, they used to say, you know, you crack open a chicken leg or something like that, or a chicken bone, you can suck the marrow. Some people eat the marrow out the chicken bones, but inside of your bones as well, you also have marrow, okay? And that marrow is where those white blood cells or those plasma cells are made in everybody. But again, The problem comes in, it's not having these plasma cells, is when these plasma cells start growing and they really shouldn't be growing because the body is saying, hey, I don't need you around. But unfortunately, they're not listening to the body's normal machinery and mechanisms. So you can kind of see from this picture, when you have a normal, healthy bone marrow, the cells kind of, have plenty of room to kind of do their thing and mature and do, I kind of tell people it's kind of like maybe childbirth or something. I don't know if any of the women on here done had babies, but at about 9 months, you like, Lord, get this baby on out of here, right? That's why, you just run out of room. You know what I mean? Sometimes it affects your breathing. You can't even lay down too good because the belly in the way. Sometimes you have trouble going to the bathroom because your stool can't come out. So it's problems. The same thing happens when these myeloma cells, you got these cells or these plasma cells that's growing inside that bone marrow and it runs out of room. And so unfortunately, that leads to a lot of problems and even sometimes even fractures that bone or breaks that bone because those cells just growing. And unfortunately, they just don't have nowhere else to go. And it creates a lot of problems. One thing to know is that why do we get this? We don't know. Okay. But we do know that it's typically something that happens in people as they age, meaning that, like, in people who are older than 50, 60 years old, we typically see this disease. Okay. Kind of more common in men than women, but just know that from a race standpoint, people who are Black folks, unfortunately, get this twice as commonly as any other people. And just know that, people trying to figure this out, really why they get it, okay? But we really, unfortunately, just really don't know. But we do know that once you get it, there's some things that you could potentially have go wrong, and that could potentially be a clue that, hey, you actually got this multiple myeloma. The number one thing is that sometimes people can have elevations of calcium in their body. He said, what the heck that got to do with anything? Well, if you remember, like I said, these cells are growing inside of the bone, in that bone marrow. Most of the calcium that you have in your body is inside of that bone. So you remember they used to say, drink milk, get strong bones. But what happens when the bone breaks? That calcium that should be inside that bone, unfortunately, is floating around. And when you have high levels in the blood, people can for sure get multiple myeloma. Also, too, these extra cells can damage the kidneys. If you think about it, the kidneys are like a big filter, and anything that goes in the blood needs to be filtered out, and the kidneys are that filter. So imagine the kidneys having to work harder to get rid of these extra cells. Like any organ, if it worked too hard, at some point it's going to be like, whew, I'm tired. And it creates problems. Okay. So when people have kidney problems, sometimes that reason for that is multiple myeloma, as well as people can have anemia or low blood counts, red blood cell counts. And the reason for that is that that bone marrow where these cells are, it's typically a factory that makes those red blood cells. But now, unfortunately, that bone marrow is full of these extra cells. The bone marrow just can't make enough of those red blood cells and people get anemic. Okay. And then also people can get bone problems. So, again, for those reasons, if people saying that you have any of these problems or your loved one is having these problems and you happen to be Black, again, like I said, your risk of developing this is much higher than the average person. Okay. So then people may do some tests that might include things like blood tests or something called a bone marrow biopsy. You say, what the heck is that? We may actually need to look on the inside of your bones in the bone marrow and say, well, how many of these cells are there? Is it, I don't know, 10% of your cells? Is it 100% full? We need to know exactly what's going on. We may even need to do a full body scan called a PET scan to look and see if there's any areas of extra cancer anywhere else outside of the bones, because unfortunately that can happen. The problem with cancer is that cancer don't really got a roadmap. It's going to kind of go where it want to go. And what we need to do is we need to know, as the doctors taking care of you, where all is it? Because if what we don't know, sometimes can be a problem. If you having shortness of breath and we don't know that the cancer's gone to your lungs, then we wouldn't know that that's the problem. We might be thinking it's still your asthma that you didn't have for 20 years when it was never asthma the whole time. It was something else, you know? So we really got to get a good idea of where the cancer is. So let's talk about really what differences and stuff that we see when it comes to people of color, okay? So you say, how common is this disease? I ain't never even heard of this multiple myeloma, Dr. Blue. What you talking about? So it's the second most common blood cancers. But as you know, blood cancers is not as common as breast cancer. Blood cancers is not as common as lung cancer. Blood cancers is not as common as colon cancer. You know, all this stuff is more common, but people could still have cancers of the blood. And because that's a thing, you need to know about it. It's thin because it's affecting people of color. So again, like I said, each year, you know, about 30,000 or so people get diagnosed with this multiple myeloma. And they say currently, you know, somewhere between 130, 150 people living in the United States with this. And again, like I said, it's typically people as they age, the most likely people to get this condition. And so, like I said, it happens a little bit more commonly in men, but as you can see here, if you see in that little graph, you see how when you come to black, how that thing is way over there? Is because unfortunately, when it comes to us, we just have twice the chance of getting this. So who should be the people who know the most about this? It should be us, because we most likely to get it. Okay. And so, you know, that's really why I wanted to kind of talk to people today, because this isn't a disease that's out here hurting other communities, it's hurting us. So, you know, one of the things that, you know, I wanted people to kind of look at here, and this graph, I know the graphs and stuff can be a lot, but just know that out of any other group in the world, okay, you take Hispanics, you take Native Americans, you take, you know, Chinese, Japanese, you know, you take any other Asian, you know, any other group in the world, Black folks right at the top, okay? So we are the people that this disease affects. Matter of fact, for the people who need to see it, you see that green color that's up there? That's us. You see all them other colors that's down there? That's everybody else. So you could clearly see there's a big difference between us getting this disease and everybody else. So we got to make sure that we do a better job. So you can also see it here. Not only do we get it the most, which, you know, Black folks are this kind of blue line that's there, but we also die from it the most. You understand what I'm saying? So if we get it the most and we dying from it the most, again, who should be the people that are learning about it the most? It should be us, okay? And this also talked about a big study where they looked at white men versus Black men, okay? And they said, well, who are the people who are getting it and also dying from it? And you can see our rates of us getting it and dying from it, unfortunately, are higher. So then we say, all right, well, let's look at our sisters then. The same thing. You can put Black women to white women. Unfortunately, even for Black women, the rate of us getting it and dying from it is much higher than for white women. Okay, so this ain't just something for the brothers. It ain't just something for the sisters. It's a problem for all of us. Okay, and I just wanted to make sure everybody was aware of that, because again, what we don't know can sometimes hurt us. Okay. All right. So then people say, all right, well, you know, I don't really know much about this disease. How do I know that I'm at risk for this? The more birthdays you have puts you at risk, because just by having birthdays and being older, you are at risk. Okay. Ain't nothing you can do about that. We want to have you keep having birthdays. Okay. But just know that that is a risk. Okay. Sometimes people can have a pre-cancer to myeloma, something called MGUS. And basically, if you have a pre-cancer that has a higher chance of developing the cancer, then you know that you more likely going to get it. And they actually show that Black people, when it comes to actually getting the pre-cancer, actually have a much higher chance of getting the pre-cancer. So you say, well, you know, if if I know that the precancer at some point, even if it's 10, 20 years down the road, gonna turn into cancer, and Black people have a higher chance of getting a precancer, then we know that that's really where the problem is, okay? Not only that, we found out that really for Black folks, instead of us getting it in our 60s and almost in our 70s, we getting it about 10 years younger than the average folks. So meaning that you could be in your 50s and having problems where everybody else may be in their 60s. Okay. And that's an important thing for me to bring up, because you could be 50 some years old, right? And your doctor, you might tell your doctor, say, hey, I heard about this thing. Your doctor said, no, 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 no. People don't get that till they older. And you say, no, 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 not Black folks, right? Because unfortunately, we have a different set of rules. Okay. So it's just something that needs to be on your doctor's minds and maybe even on y'all minds if you're having some problems, because again, we get it at a younger age that people wouldn't necessarily be thinking about. This is the problem. And it's one of those things that they really haven't been able to figure out. Cigarette use, they didn't really see the association with it. They, as far as educated Black folks versus uneducated Black folks, it didn't matter. Rich Black folks versus, poorer Black folks, it didn't matter. Okay. And so, sometimes, we get a little change in our pocket. We think that we rise above it. But I'm telling you, this is one of those things that is there that we need to know about. All right. And I'm not trying to be here to scare folks either, but I'm just here to educate and to make sure people know exactly what's going on. Okay. And so again, like I said, not only do people get it younger, but we also, the way that we what they call present with the disease, or the way that we show up with the disease, is actually different than how other communities show up with the disease. So a lot of the data shows that Black people, when they get the disease, are more likely to be what they call anemic or have a low blood count. Okay. Now, other people may be having some of the bone problems, or they may have, some of those other calcium issues, all that other stuff that I talked about. But for us, one of the big things that we see is anemia. Okay. And just know that just because you anemic don't mean that you got myeloma, but for sure that's something that people need to be thinking about. Okay. Because again, it's higher in our community. So I think, as the great sister Mia had talked about before, that even if you go to the doctor, they send you to a cancer doctor, they find out that you got this thing, that it's actually differences in the way that people are treated based off of their race. Meaning that, like, you got a white person here with the same cancer and a Black person, and unfortunately, we notice that there are differences. You say, well, what you mean, Dr. Blue? Basically, the studies basically show that if you are either Black or Hispanic, the time from you getting your diagnosis to starting treatment could be somewhere about 5 months, compared to someone who's white. They have about 2.5 months, meaning that that's almost half a year from the time you get diagnosed to start treatment than any other group. Like, that don't make sense. Now imagine somebody telling you in January you got cancer, but you not starting no treatment till May or June. That don't make no sense. Okay, especially when everybody else might be diagnosed in January and they having treatment by Valentine's Day. That don't make sense. Okay. And so, for us, it's something we really have to be careful of. And we have to make sure that all the treatment and stuff that's available to us, we taking advantage of it. Okay. Because we see big differences when we look at, really thousands and hundreds of people. However, one of these studies came out that I thought was super important that I wanted to share with y'all, is that they did this. I don't know if people are familiar with the VA. So the VA is, as long as you were what they consider active duty military, okay, a lot of times you can go to the Veterans Hospital and get a lot of your medical treatment, okay? Sometimes even your family members of active duty military people can go to the VA. But the thing to know about the VA is that because they are taking care of you, you may not need Blue Cross Blue Shield. You may not need Aetna. You may not need Humana. You may not need health insurance because the health insurance is provided to you by the VA. okay? And they found out that if you take all the people in the VA who got the same kind of healthcare system, okay, that they noticed that that big difference between white and black, I don't know if you can kind of appreciate that, but them lines came together where before they were separate. And so that basically showed that, if you treat everybody the same, a lot of times you're going to get the same result. But, unfortunately, insurance gets in the way, what they call prior authorizations get in the way. A lot of this stuff that creates so many barriers for our people that unfortunately is killing us. Okay. So, I'll say this to say that if you know somebody who don't got insurance, you know, cancer cancer is never convenient. You know what I mean? So, people always say, oh, I'll get insurance next year. If you get insurance, you get the right stuff going, that means you can still have a good outcome. Okay. But it's when you got to wait to get insurance, wait to get all this stuff. That's when, the because just because you waiting, don't mean the cancer waiting. You know what I mean? It's still going to be growing in the background. So I just want to tell people that, we really got to do a good job of really helping ourselves. Okay. I wanted to bring this up as well because I think this is super important. So, like, when any new medication come around, the only way that that medicine is going to get approved by the government is if there's research proving that this drug actually works. The government not just going to approve some medicine because Dr. Blue says so. They're going to need some proof. And how they do that is with clinical trials. Okay. And with clinical trials, they basically compare these different drugs and they basically say, all right, I got drug A. I'm going to compare either drug A to drug B and see, hey, drug A worked just as good as drug B. Maybe this need to be a drug that we make available to people. But the thing that's important is that a lot of us, as far as minorities, Black and Hispanic folks, we don't sign up for these things. And if we don't include us in these trials, then the question is once this gets approved by the government, how do we know it's going to work for us? Because we was never a part of the original studies. And that, unfortunately, has led to a lot of big problems, okay? So I'll just show you this, okay? So if you look at this graph all the way on the right, you see that yellow kind of orange line. That's the amount of white folks who are participating in clinical trials. Almost 80%, meaning that like 8 out of every 10. That's a lot. Now go all the way down till you see a light blue number. Oof, you barely can see it. We so low at the bottom. Now, that means that, we just really aren't participating in these clinical trials and getting these drugs approved. So when these things come out, we assume they work for Black folks. I don't know. But the only way to know for sure is if we sign up. So if you ever get that opportunity and the doctor's telling you, or maybe if a doctor don't even tell you, you might just ask and say, hey, is there any clinical trials I could be a part of? Then that's really going to help not only you, but it helps, your family, it helps your kids, helps your grandkids, because they know that it works for everybody, not just for a certain group of people. So, one of the big things that I want to just kind of leave people with understanding is that, if you someone of African descent, okay, just know that when it comes to this myeloma or even the precancer myeloma, you're more likely to get it, okay? And know that how you show up to the emergency room, how you show up to your doctor with developing this cancer is going to be different. So your doctors can't just be thinking of, hey, however the white folks typically present with this is how it's done. No, there is a difference. Okay. Also know that whenever you do get diagnosed, how the treatment is delivered and how fast you get the treatment, all those things are differences. Okay. I think as the good sister Mia also said as well, we like to take, social economic stuff out of this, but that's important, okay? Especially stuff like insurance and, those things are very important because, cancer medicines and none of that stuff is cheap. And we want to make sure that everybody can have access to these medicines. But we know, again, like I said, from the VA message that I talked about, that if everything was equal, though, a lot of the differences that we see does make it seem like those things go away. Okay. It's also important to know that, not only again do we get this disease the most, but we also die from it more often. Okay, so it's just important because representation matters. Okay, so when it comes to us, it should actually be the reverse, because since we get this more, you would expect to see our name at the top of any clinical trial, because you're like, oh, let me sign up. You know what I mean? This going to affect me. This going to affect my sister, my cousin. Let me be the one who actually sign up to figure out if it's any new medications available. Okay. Now, I put this in here because I wanted to just tell people that while this talk is about myeloma, and which is a cancer that is super important to me, again, like I said, it's one of the rarer cancers. I want to just briefly talk about some of the more common cancers to let you know that that same problem that I just talked to you about in myeloma, we see also for other cancers. For example, prostate cancer. Okay. Black men, they get prostate cancer and die from prostate cancer at a higher rate. All right. If you're Black, you should be getting tested for prostate cancer. Okay. Get a test called a PSA. All right. If it ain't you, tell your boo, your husband, your boy, your sons. Okay. To get tested. Okay. And again, like I said, the same clinical trials like they have for multiple myeloma, they have for prostate cancer. And if you're Black, you need to sign up for that, because again, the only way we know it works is if we sign up. Same thing for colon cancer, right? Everybody, when they have their 50th birthday, should be getting a colonoscopy if they can. Okay. There's a lot of different ways to get tested, but the colonoscopy, they have these little cards you can do, but get tested some kind of way. It's actually a lot of data that shows that if you're Black, we may want you to start getting it at 45. You understand what I'm saying? So just know that um it's we running in last place in a lot of different cancers. Okay. Thing, and people always ask, like, what can we do? You can't change who your mom and your daddy was, right? You can't change how you were born and stuff that you was born with, but you can change your weight, what you're eating. Okay. You can change if you're smoking. Okay. You can change if you talking to your family about what's going on with you, right? Because that's something you can do tomorrow. That's something you can do today. Okay. And just know that, it's a problem. The other problem too is lung cancer. There's a study that basically showed that even when Black people smoked less cigarettes, they still was more likely to get lung cancer. So people say, well, I only smoke a little bit. Or, common thing people say, I only smoke when I eat, or I only smoke when I drink. Even with less tobacco use, still had a chance of getting more likely getting it. So, I just know that, for us, what the commercials you might hear, the stuff you might hear on TV, sometimes just don't apply to us, because we are what they call an at-risk group. Okay. And we are more likely to get it than some of these other things. So if your doctor is saying, oh, you may not need that, you say, no, 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 wait now, hold on. You got to remember, it's different for my community. So, take some time to think and say, well, when was the last time I've been to a doctor? What did I go to that doctor for? Okay. Is this something that I'm really seriously thinking about my health? Because I know, again, what I don't know could potentially be hurting me. I put this little cartoon in here and say, when's the best time to put on a helmet? Before you get on the bicycle, while you're riding the bicycle, after you already fell off, right? It's one of them things you want to make sure that you stand on top of this stuff, putting the helmet on before you even get on the bike so that you're ready and prepared, you know? Same thing with a tire. When's the best time to change the tire? Is when you notice that it's first starting to break down, after you done already blowed up on the side of the road, having to walk somewhere. Okay. It's always better to be what we call preventative, or be on top of stuff. And that brings me up to another important thing, is that we actually have a research study here at Moffitt. We're doing it with Dana-Farber, which is the Harvard program, John Hopkins, Mayo Clinic, all the big centers is doing this because this is super important. Is the same way people get a mammogram for breast cancer or get a colonoscopy for colon cancer, we're trying to develop a screening for multiple myeloma. So you say, well, how do I do this? It's called the PROMISE study. So I tell everybody, if they go to promisestudy.org, they can sign up for this. It's free. Okay. You sign up, you collect, you accept the little terms, and we will send you a little kit in the mail. You take that the little kit to Quest, which Quest is like a little lab draw place where to draw your blood. And then you get results. The results will say, hey, you're positive, or the results will say you're negative. Okay. It's free. You say, well, how do I know if I can be a part of this? If you are, again, somebody who considers themselves to be Black or from African descent, African American, and you 30 years old, you can go to promisestudy.org and get this, again, for free. All right. Or if you are a family member of somebody, meaning that, like, if your cousin, well, not necessarily cousin, but your brother, your sister, your mama, your daddy, somebody like that, um, has one of these cancers, then you are considered, again, high risk, and we want to make sure that you get tested or screened. Okay. So again, you 30, African descent, you just go to promisestudy.org, and we're gonna send you these little kits, okay, for free. All right. Now, who is not included in this? If you already got cancer, this is not for you. Okay. This is for people who don't got cancer. We want to find out if they have it. Okay. So if you are a person listening and you like, oh, doctor already told me that they watching this, or they, already got maybe the pre-cancer, and that this is not for you. This is for your sister, your cousin, your brother. You know what I mean? This is for them, your family members. Okay. And so what happens is that once you get that kit, okay, you take it to Quest. All right. Quest will know all about it because it'll be like a little code system. All right. The Quest has these people that'll draw your blood, and they'll return that package to us. Okay. When you go to Quest, again, you just would put in a little information, you schedule your appointment, and again, it's free. Okay. And again, most people, depending on where you live at, have a Quest somewhere within about 5-10 minutes, so it ain't like you got to go typically too far. And then you get these results that'll say, hey, we found something that's positive. Unfortunately, we think you need to see either a blood doctor or a cancer doctor because we found something. Okay. Or to say, hey, we checked you and we didn't see nothing. And the good thing about it, you can actually test again in a couple years. Say, hey, we didn't see nothing now, but maybe check back with us in a couple years just to double check and make sure. Okay. So again, I'll tell everybody, you look at here, promisestudy.org. Okay. And even if you just remember Promise Study, if you put it in Google, it's the first little like hit in Google. Okay. And again, African American or African descent and 30, boom, you already qualified for this free thing. Okay. So I appreciate y'all. Thank y'all for y'all time today. Hopefully people learn some stuff today. And that's really what I wanted to share with y'all today. And God bless, and hopefully we can talk more and people have questions.
Dr. Blue, I want to extend another thank you for this education that you have provided on this evening's webinar. If you all do not understand why I strongly and encourage you all to attend these webinars, especially with Dr. Brandon Blue, I hope you have learned this evening. I enjoy the way that he educates the community. He talks to us. He does not talk at us. We will check and see if there are any questions in the Facebook or in the Zoom chat, but I do have some comments and or questions that I would like to ask Dr. Blue, if you don't mind.
Sure, of course, that's why I'm here.
First of all, one of the comments I want to make is, if you all heard, Dr. Brandon Blue is expressing that we be advocates for our health. You know that something's wrong and maybe your healthcare provider is like suggesting you brush it off. We need to be advocates, to be smart enough to say, you know what? I don't feel too good about this. Maybe I need to perhaps find maybe another physician that might be able to take my concerns a little bit more seriously. So being an advocate for yourself is very, very important. I thank you again, Dr. Blue, for talking about the disparities that we have for our African American population. It's very important that we do understand the disparities that affect us when it comes to any type of cancer. Here is a question I have for you, though. You indicate that the numbers were low when it came to research and actually Black people of African descent being a part of these studies. Now, I want to guess that maybe one of the reasons might be lack of knowing or lack of knowledge. What would be some of the other barriers that you think may be preventing our Black people from being a part of these research studies?
Now, you know, as well as I know, the number one reason is, Black people, we just ain't doing it. Well, you know what I mean? Imagine when I don't know if you remember when them COVID vaccines first came out, we was the first one to say, oh, they ain't sticking me, But what I'm telling you is that a lot of times, and again, this is tough because sometimes this stuff is very complicated science. You know what I mean? And sometimes, it could be 20, 30, 40 years since any of us been in a science classroom. So these people talking stuff, they're not really making sense. And then they like, oh, well, we want you to be the first one to sign up. Be like, not me. Right. So I think that's a lot of the issue, especially when it's a cancer that you maybe never even heard of. You say, wait, you want me to be on some? I never even heard of this thing. It's too much. You know what I mean? And so I get that. I promise you I get it. That's why I'm saying that, even maybe even not the first time you hear it, but maybe like, hey, I remember Dr. Blue, this guy talking to me about this. This was super important. Boom. At least it's not the first time you heard it. It's the second time you heard it, the third time you heard it. You know what I mean? And so, I think that's probably one of the biggest reasons is that, I tell you, as Black folks, we count the money as it come out of the ATM. We don't even trust the ATM giving us the right amount of money. You know what I'm saying? We like, hold on, we lick our fingers, make sure the 20s ain't stuck together. That's just how we are as a people. And I get it, you know what I mean? Because there's a whole bunch of reasons for that. You know what I mean? And just to be honest with you, a lot of times America hasn't really done right by us. You know what I mean? And so, we not gonna really try to be the first one jumping in line for anything when we know that a lot of times they have hurt us. You know what I mean? It's only so many times you're gonna touch the fire before you say, hold on, maybe I don't need to touch this fire no more. But what I'm telling you, and I'm here to say, is that things are changing. Okay, especially when it comes to things that are pertinent to our community. All right, is that everybody else signing up for these clinical trials and they actually benefited from it. They living longer, they getting the latest and greatest. But unfortunately, we get stuck behind. Okay. And so, so that's really what I'm trying to tell people is that, I get it. And it's understandable to be hesitant, but to just know that really this is really where we need to be. And really we got to help ourselves and help our brothers and our sisters.
Yes, thank you so much for that. Let me ask you this. Are there any grants available when a person is diagnosed with multiple myeloma? I know these medications can cost thousands of dollars. Are there any grants in place to help these individuals be able to afford the treatment in an effort to live longer?
Yeah, I would say the best person to answer that was my sister Mia, but I'll tell you her organization, LLS, does a fantastic job. It's the Leukemia and Lymphoma Society, but they also take care of really any blood-related cancers, including this multiple myeloma, which again, ain't nothing cheap. You know what I mean? That's just the world we live in. But it's places like LLS, which is easy to remember, lls.org. Okay, they keep it simple. Okay, or you could just Google LLS. Again, it's going to be one of the first hits. Okay, because it's money out there. It's people who literally give money to say, hey, I want you to give this to somebody when they get diagnosed with cancer because I know how expensive. Like it's people that I give money, you know what I mean? Because I know how expensive it is, And so it's just an important thing. And so it's, LLS is one, but it's plenty of places similar to LLS. But I know LLS is one of the biggest ones. Okay. But it's plenty of ways out there that if you do have cancer and you're struggling to kind of either pay your bills, because that's another thing people don't talk about. Just because you get cancer don't mean them bills gonna stop. Don't mean rent still ain't due, right? And now you undergoing chemo and treatments, there's organizations out there that will help you. And again, like I said, LLS would be a great start.
Yes, thank you so much for that. I'm checking to see if there are any questions. It seems as though there are no questions on Facebook, no questions on the Zoom chat. Is there anyone here currently on this Zoom that wants to open mic and ask Dr. Brandon Blue while you have a chance, because he is a busy, busy young man. Get him now while you can if you have any questions. It looks like there is a question. Okay, all right. First of all, great information. Question number one. Could you speak more about tobacco use as a risk factor for multiple myeloma?
Yeah.
What about a previous tobacco user who hasn't smoked for multiple years? Are they as at risk as those who are current smokers?
Yeah. So I'm glad you brought that up. So, the when we do the research, we really try to look at and say, well, who are the most likely people to get this cancer? And, for cigarettes and lung cancer, it's very clear. Okay. Typically, as people smoke, okay, even if people stop smoking, they still typically, depending on how much you smoked at that time, put your lungs at risk for lung cancer. All right. For other cancers, such as colon cancer, it's also very common, and that association is there. For myeloma, we don't see that same kind of association as commonly, okay? Meaning that, like, even if you have smoked or stopped smoking, it puts you at risk for other cancers, but not necessarily this one. But I will say this, okay, is that once you open the door for one cancer, meaning that like your body has lung cancer or prostate cancer or whatever cancer, you unfortunately open the door for other cancers to come in. All right. What they used to say, you give me an inch and I take a mile. That's how cancer is. You open that door a slight little bit, okay? Even if you have what they call pre-cancer, that means that something ain't right, and it might be something brewing. Okay, they used to say it's on the pot and it's stewing. You know what I mean? I don't know if people know nothing about a good stew that just takes a long time. Cancer does that sometime. Okay, and what we want to do is we want to make sure that we check that stew before it bubbles over. Okay, because unfortunately, if anybody's ever had some stew or anything that bubbles over, you catch a dog trying to get it back in that pot. You understand what I'm saying? It's just so hard. And so that's why, again, that's why I use that kind of helmet analogy that like if you try to be what they call proactive, you know what I mean? And try to like do this stuff before it get to where it's already bubbling over and you breaking bones and your kidneys shutting down and you need to be on what they call dialysis and all this kind of stuff. It's hard to get back. You know what I mean? But I mean, we still do it, but imagine if you would have did it before all these problems came up, and that's just, that's my message that I want to preach to people.
Thank you. Next question, Dr. Brandon Blue. Other than the PROMISE project, are doctors testing for this disease or must someone ask for these labs?
Yeah. So the PROMISE study is research. Okay. We don't really know. I mean, it makes sense to us, but it's not proven that if you screen all these people, it leads to better outcomes. But that's why we're trying to study it. That's why we got the biggest centers in the world to join this. You know what I mean? Harvard, us, John Hopkins, all these big places, you know what I mean? Because we need a lot of help. So that's why it's free, because the research study is actually paying for it. You ain't never really had too much stuff that's free when it comes to healthcare. All you got to do is, again, it's going to cost you some time because you got to go on the internet, and it's going to cost you some time because you got to make an appointment at Quest. But really, other than that, it's free. Okay, so it's not something that's considered standard. But imagine in a couple years if we say, hey, we found out from this PROMISE study that if you test every Black person at the age of, I don't know, 50, that improves their outcomes and they can actually be prevented from getting this cancer the same way they get a mammogram, and that prevents them from getting breast cancer. Then imagine the world difference that'll be for your kids, for your grandkids, because of this study. You know what I mean? That's something that we would have learned that we just didn't know. And that's really where we at right now. Because this is a rare cancer, it's so much stuff that we don't know, but we hope what we know in 2030 is different than what we know now in 2023. And really, some of you on this could really be the reasons for that change.
Okay, thank you again. I don't think I have any other questions. Again, Dr. Brandon Blue, I enjoy spending these few minutes with you because you really know how to educate our people, more so educate and advocate for the community. Now, I'm going to have the closing remarks done by our cancer chair, Dolores Williams. She is going to close us out, give any other additional remarks, and I want to thank you all again for joining us this evening. Mia Johnson, Dr. Brandon Blue, what awesome information. Mia and I go back several years, so we've had a relationship here for a long time. And when I found out that she was one of the big names for LLS, I said, you have got to be kidding me. All this time, I did not know that you played that significant part in LLS. So thank you all again. Of course, Dr. Brandon Blue, don't you change that email now, because you know I know how to find you.
Yeah, you can find me anytime.
Yes, indeed. Well, go ahead, Miss Dolores Williams, with our closing remarks, please.
Thank you, Madam Chairman. Can you hear me?
Yes.
Okay, I can't see you all, but that's okay. I mean, you can't see me, but that's all right, because I see you. And I heard Dr. Blue, and I heard him loud and clear. First of all, I'd like to say on behalf of the Hillsborough County chapter of the Charmettes Incorporation, we would like to express our sincere appreciation to our distinguished presenter, Dr. Ronald Blue, as well as Miss Mia Johnson. Thank you so very much for sharing your valuable information and time with us. We really, really do appreciate it. We would also like to say to our special sisters, Charmette, Dr. Sabrina Nelson Winters and Kimberly Hines, thank you, sisters, for the work that you've done for Charmettes. We really do appreciate it. Again, thank you so very much. And for all of you who have come in and listened to this presentation and have enjoyed it and learned something, we certainly do appreciate you being on this presentation. You know, they say that everyone should learn something new every day. Well, today, because of you, we learned something, and we thank you so very much. Have a good evening.
And that concludes our show. Have a great evening, everyone, and thank you again.
Thank you.
Thank you. Y'all take care.
Thank you.
Thank you.